You mentioned that you were involved in IT for a long time. Explain the experience and what it was like for clinicians just up until the last few years who are trying to embrace IT.
Well, it's been a very difficult experience. I've been a user of electronic medical records in the practice setting for about 17 years now. I'm on my third EMR, and you know, it's been challenging. I would consider myself very fluent now, so I can pretty much use any product because there's a lot of similarities between them. But getting to that level of expertise has been extremely difficult, and the mechanisms that have been used in terms of the implementation and the adoption of these products has really not been terribly good. The other thing is that there have been so many different market forces that have created what we now see as a traditional EMR that's actually made it very difficult for us to really adopt them well, to get full advantage out of these products that are out there. Certainly government intervention has been a big problem for us as well. The HICVA E&M codes from the mid-90s really contributed to a lot of the problems that we have from a documentation perspective in the doctor's office. So with all these things that have been going on, the products have never really been able to get to the point that they're easily usable by the bulk of physicians out there. Certainly certain groups do very, very well if they have a lot of support, a lot of resources. Academic medical centers, for instance. The physicians are told which product they're going to use. They have to use it. But they also have the IT support and a number of other folks. Everyone's using the same product. They're in a very closed setting. It works great. The problem is that more than 80% of physicians are not in those types of settings. They're very distributed. It's very difficult to get out to those docs and be able to give them the level of training and support that they need to be able to succeed as well as some of these other groups have.
Given that physicians have had a lot of IT shoved at them in the last few years, how significant is the development of the portal, where they get to, at the point of care, they can have all of this information streaming to them on the patient in real time from all these disparate departments?
Well, part of it's the portal aspect itself. Part of it is just the whole interoperability realm itself, health information exchange. Extremely important. You know, when I have been seeing patients in the office over these years, even with an electronic medical record, that just really replaced the paper record that I had in the past. And so it was still siloed information that was within my four walls for the most part, and incorporating data from outside as I would get it, but really it would only be bits and pieces of it. So when I was seeing the patient at the point of care, I rarely had the information I needed to really make the best decisions with timely information, and also the support that technology can give us. Clinical decision support tools that are able to take the data, work it, and give me some feedback and perhaps preventive measures that need to be done, or using evidence-based medicine guidelines to support the proper care of the patient. Without having all that information together, it's very difficult to be able to make those decisions that need to be made for the patient to get the best quality and efficient care. The other side of the coin is, you know, what do you do with all the information that is out there, because you can't really take it in. If you were to put it in the paper realm, use an example of a colleague who had a child that had some significant medical problems. By the time they were going to their second or third major medical center, they were taking a red wagon to pull the chart around that had accumulated that they did a very good job of putting together in one place. And they were pulling around just reams of paper. Of course, nobody could go through all of that. So there's our next problem, is that it's not just having all the information available, but it's be able to put it in a form that's very usable and workable for the doctor when they're making those choices again. And in this portal concept, and also using the different tools that are available out there, we can now start taking that information and pull it together in a summary format that makes sense. Demonstrate trending, do graphing, do those types of things. It takes a bulk of data and puts it in a very usable form.